Are you struggling with knee pain that probably limits your ability to walk long distances, climb stairs, straighten your knee, hop or run? Well, you might be dealing with a degenerative meniscus tear. I'm physical therapist Katie Wolfley, and today we are talking about just that. So if you're unfamiliar what a degenerative meniscus tear is, it is a wear and tear of our meniscus, or the cartilage inside our knee joint, that protects our surfaces from our lower leg bone and the upper leg bone from too much contact. Over time, with repetitive movement, a lot of bending, poor mechanics, that meniscus can wear down and have little kind of fraying to the edges. It can be very painful for a lot of activities. Those usually include bending, maybe you're having difficulty straightening the knee, which can be a sign that there is swelling going on inside that joint. All of those types of movements are going to be painful and going to be able to make things difficult for your day-to-day activities. You're also probably going to find that if you're poking around on the knee, right where our two bones come together here, it might be tender right along that joint line, right at the crease where we bend, and that can be a sign that degeneration is going on. It's different from a traumatic injury in that something didn't immediately happen. There wasn't an event. This is usually something that occurs over time, like I said, with that repetitive movement. So if you're dealing with something like this, you are in luck. A tear or an injury like this doesn't mean that you necessarily need to have surgery. We can always go through physical therapy, and actually some research has found that patients who go through a program versus having surgery and then going through a program both have similar outcomes. So anytime we can take down your need for surgery, which is absolutely invasive, you're gonna do way better. So there are definitely some things that you can try. If you're thinking, maybe this is me and I don't wanna go through surgery, I'd like to try something more conservative, absolutely. There are a couple of different exercises you can try, and I'll show you two right now. One of the things that we definitely wanna work on is our ability to squat. Squatting is a bending motion that we should naturally do functionally during the day, throughout the day, reaching for something, cleaning, picking up our kids, happens all day long. And when we're doing a squat, what we don't want to have happen is have our knees go way forward over our toes. When our knees come forward over our feet, that puts so much pressure and weight right in the front of that joint and asks that meniscus to take a lot of load bearing. It's meant for shock absorption, but if we overuse it over time, it's not going to last very long, right? So when we do a proper squat, we want to have our feet parallel, and we want it to actually be dominated by our hip motion and not our knees. So imagine if I had a chair behind me, it's as if my butt is going backwards to find a chair that doesn't exist. And as you notice, that keeps my knees right over top of my ankle, which means there's less weight bearing through the joint, and I'm keeping all of those soft tissues a lot happier. If you're someone who struggles with a lot of pain during bending, take a little bit modified. Say my right leg was one that was more painful. I'm going to shoot that foot just a little bit more forward in front, and as I go back with my hips doing that great squat position, I'm putting a lot less weight into this foot. That means less load bearing, and that's exactly what's going to kind of eliminate some of that inflammation process going on. Another great exercise that you could try is working on step-ups. So if I grab a step here, when we climb the stairs, a lot of what we do is push our knee over our toe and go too far forward. When we're working on a good form, our whole foot needs to be on the step. I'm going to bring my chest towards my thigh. I like to say you're bowing towards the leg. When I do that, I'm going to load a lot of weight into my hip, and then when I come to push up, I get to use all the muscles on the front of my thigh, back of the thigh, and my hips. Our hips have the largest muscles in our body. Make them do the work. And then when you come to step down, very gently loading ourselves backwards again into that hip hinge, keeps that knee over top the ankle, protects that joint, and eliminates all of that extra added pressure. So try these out, see how they work for you. But if you're looking for a more personalized plan, or maybe you're dealing with a lot more pain than you've anticipated and you want a personalized plan, get in touch with us. All of our physical therapists are going to create a personalized plan that works for you. Check us out at buffalorehab.com and get in touch today so we can get your life back.